Hey everyone, Dr. Robert Harper here.
And Dr. Akira Tanaka. Robert, before we start, I have a question for you.
Shoot.
Why do Americans fear salt, but eat the saltiest food on earth?
Okay, that's a fair point.
Every patient tells me, I stopped using salt. But they eat crackers, chips, frozen dinners.
Pizza, deli meat, canned soup.
Yes! And then their ankles swell. And they think, I must drink less water.
Which is the worst thing you can do.
Exactly.
All right, here's what's happening. Right now, as you're watching this, millions of people over 50 are dealing with swollen feet, puffy ankles, tight rings.
And most of them think it's just aging.
But here's the truth. Swelling isn't about how much water you drink. It's about what you eat.
Your body is holding water for a reason.
And today, we're going to show you 5 foods, common, cheap, available at any grocery store, that can eliminate swelling in as little as 48 to 72 hours.
No diuretic pills. No extreme diets. Just real food, used the right way.
But there's a catch.
If you're on certain medications, blood pressure pills, heart medications, some of these foods can be dangerous.
He's right. We'll cover that in detail later. But if you're taking diuretics or ACE inhibitors, pay very close attention when we get to that section.
Because the difference between helpful and harmful is one banana.
Literally. So here's what we're doing today. First, we'll explain why your body holds water.
The sodium-potassium balance that nobody talks about.
Then, the 5 best foods to eliminate swelling naturally.
After that, the Japanese approach. Because I'm going to blow your mind with how much sodium Japanese people eat. And why we don't swell.
Miso soup every morning. High sodium. No swelling. I still don't understand how that works.
Miso soup every morning. High sodium. No swelling. I still don't understand how that works.
Cranberry juice. Detox teas. Celery cleanses. All the stuff you see on Instagram that's either useless or dangerous after 60.
And finally, the most important part. If you're on medications, what you must avoid.
Because we've both seen patients end up in the ER from mixing the wrong food with the wrong pill.
It happens more often than people think.
So here's my promise to you. By the end of this episode, you'll know exactly what to eat, when to eat it, and how much.
No confusion. No overwhelm. Just a simple plan you can start tonight.
And if you're someone who's been struggling with swelling for months, or even years, this could be the answer you've been looking for.
But before we dive in, should we tell them about the water myth?
Oh, we have to. Most people think, I'm retaining water, so I should drink less water.
And that's like saying, my car is overheating, so I should remove the coolant.
Exactly. Your body needs water to release water.
When you're dehydrated, your body panics. It thinks you're in a desert. So it holds on to every drop of fluid it can.
Which makes swelling worse.
So if you take away one thing from this episode before we even start, do not cut back on water.
In fact, most people need to drink more.
But, and this is important, it's not just about water. It's about what you eat with that water.
Because if you're eating high sodium, low potassium foods, all the water in the world won't help.
Your body will hold on to it like a sponge.
The water is not the problem. The food is the message.
I like that. All right, let's get into the science. Why does your body hold water in the first place?
It all comes down to something called the sodium-potassium pump. Every single cell in your body has this mechanism.
And when it's out of balance, water accumulates in the wrong places.
So here's how it works. Sodium pulls water into your tissues. Potassium pushes it back out.
It's like a dance. When sodium is too high and potassium is too low, the dance stops.
And water just sits there. In your ankles, your hands, your face.
Now, the problem in America and increasingly in other Western countries, is that processed food is extremely high in sodium and almost zero potassium.
A frozen dinner can have 2,000 milligrams of sodium, but maybe 200 milligrams of potassium.
That's a 10-to-1 ratio. Your body needs the opposite, more potassium than sodium.
Ideally, you want about 4,700 milligrams of potassium per day. But the average American gets maybe 2,500.
And sodium? The recommendation is 2,300 milligrams. Most people eat 3,500 to 5,000.
So you're doubling sodium and cutting potassium in half. Your body has no choice but to hold water.
It's trying to dilute all that excess sodium, but it can't get rid of it fast enough.
Now here's where it gets interesting. After 60, your kidneys don't filter sodium as efficiently.
So even if you're eating the same diet you did at 40, you're more likely to retain water now.
Your body is just less forgiving.
Which is why small changes in what you eat can make a huge difference.
And that brings us to the 5 foods. These aren't exotic superfoods. They're things you can buy at any grocery store.
But they work because they restore the sodium-potassium balance naturally.
All right, food number 1. Bananas.
Classic. One medium banana has about 420 milligrams of potassium.
And here's what I tell my patients. Eat 1 in the morning, 1 in the afternoon.
Why morning?
Because after you sleep, your sodium levels are highest. A banana first thing helps flush that out.
In Japan, we don't eat as many bananas, but we eat sweet potatoes, which have even more potassium.
Sweet potatoes are amazing. A medium one has about 540 milligrams.
And they're filling, so you're less likely to reach for salty snacks.
Now, a word of caution. If you're on certain medications, ACE inhibitors, potassium-sparing diuretics, talk to your doctor before loading up on bananas.
Because too much potassium can be dangerous if your kidneys aren't filtering properly.
We'll cover that more in the medication section. But for most people, 1 to 2 bananas a day is safe and effective.
What's food number 2?
Avocados.
Even better than bananas for potassium. Half an avocado has about 490 milligrams.
Plus healthy fats, which help your body absorb vitamins and reduce inflammation.
Inflammation makes swelling worse. So avocados work on 2 levels.
I had a patient, 68 years old, retired teacher, who had swollen ankles for 2 years.
What was she eating?
Honestly, a lot of processed food. Frozen dinners, canned soup, crackers. She thought she was being healthy because the labels said low fat.
But low fat usually means high sodium.
Exactly. So I told her, add half an avocado to your lunch every day. Replace 1 processed meal with something homemade.
And?
2 weeks later, her ankles were normal. She couldn't believe it.
That's the power of real food.
And she didn't have to give up everything she loved. She just swapped a few things.
Small changes, big results.
All right, food number 3. Cucumbers.
Now this is interesting. Cucumbers are actually a natural diuretic.
They help your kidneys flush out excess sodium without depleting potassium.
And they're 95% water. So they hydrate you while they help you release fluid.
I tell people, eat a whole cucumber as a snack. Or slice it up and put it in water.
In Japan, we eat cucumbers with almost every meal. Pickled, fresh, in salads.
And that's one reason Japanese people have less swelling, even though they eat a lot of sodium.
Balance. We eat high-sodium foods like miso and soy sauce, but we also eat high-potassium vegetables like cucumbers, seaweed, and sweet potatoes.
So the sodium-potassium ratio stays balanced.
Exactly. It's not about eliminating salt. It's about pairing it with the right foods.
All right, food number 4. Watermelon.
This one surprises people.
Because it's so sweet, they think it's bad for you. But watermelon has something called citrulline,
which your body converts to arginine, an amino acid that relaxes blood vessels.
When your blood vessels relax, blood flow improves, and fluid doesn't pool in your extremities.
Plus, watermelon is 92% water, so it hydrates you deeply.
I had a patient who swore by watermelon. Every summer, he'd eat 2 cups a day.
And his swelling?
Gone. He said his rings fit again. His shoes were comfortable.
The only caution with watermelon is if you have diabetes. The sugar can spike your blood glucose.
Right. So if you're diabetic, stick to 1 cup and pair it with protein or fat to slow the sugar absorption.
What's food number 5?
Green tea.
My favorite.
Of course it is. Green tea has catechins, antioxidants that reduce inflammation and improve circulation.
And it's a very gentle diuretic. It helps your body release excess fluid without the harsh effects of diuretic pills.
How much should people drink?
3 to 5 cups a day, spread throughout the day, not all at once.
And make sure it's real green tea, not the bottled stuff with added sugar.
Yes. Brew it yourself. Hot or cold, doesn't matter.
I'll be honest. I wasn't a green tea guy until Akira convinced me to try it.
And now?
I drink it every afternoon. And I've noticed my energy is more stable. No more 3 p.m. crash.
That's because green tea has L-theanine, which balances out the caffeine.
So you get alertness without the jitters.
And it's calming at the same time.
All right, so those are the 5 foods: bananas, avocados, cucumbers, watermelon, and green tea.
Simple, accessible, effective.
Now let's talk about the Japanese approach. Because Akira, you've been teasing this miso soup thing.
Yes. So here's what confuses people. A typical serving of miso soup has about 600 to 800 milligrams of sodium.
Which sounds like a lot.
It is a lot. But we drink it every morning. And Japanese people, especially older adults, have much less swelling than Americans.
So what's the secret?
Balance. Miso soup also has tofu, which is high in protein, seaweed, which is high in potassium and iodine, and sometimes vegetables like mushrooms or green onions.
So you're getting sodium, but also potassium and other minerals that help your body process that sodium.
Exactly. It's not just salt water. It's a complete food.
And the fermentation of the miso paste, does that make a difference?
Yes, fermented foods support gut health. And your gut controls inflammation throughout your body.
So less inflammation means less swelling.
Correct. Plus, we drink green tea throughout the day, which helps flush out excess sodium.
And you eat a lot of fish, which is high in omega-3s.
Fish, seaweed, vegetables, very little processed food.
So even though you're eating high-sodium foods, your overall diet is balanced.
Yes. And I think that's the key lesson. Salt isn't the enemy. Imbalance is the enemy.
That's a great way to put it. Because in America, we've demonized salt so much that people are afraid to use it at all.
And then they eat a frozen dinner with 2,000 milligrams of sodium and think it's fine because they didn't add salt themselves.
Right. The salt you add to your food at home is not the problem. It's the hidden sodium in processed food.
If you're cooking from scratch and adding a pinch of sea salt, you're probably fine.
Especially if you're pairing it with high-potassium foods, like the ones we talked about.
Now let's talk about what doesn't work. Because there's a lot of misinformation out there.
Oh boy. Where do we start?
Cranberry juice.
Yes. So many people think cranberry juice is a miracle cure for swelling.
It does have some diuretic properties. But most cranberry juice is loaded with sugar.
A typical glass has 30 grams of sugar. That's more than a can of soda.
And sugar causes inflammation, which makes swelling worse.
So you're getting a tiny diuretic effect, but you're also spiking your blood sugar and increasing inflammation.
Net result? You're probably worse off.
If you want cranberry benefits, buy unsweetened cranberry extract in capsule form. Or drink a tiny amount of 100% cranberry juice, like a tablespoon, mixed with water.
What about detox teas?
Oh, detox teas. These are dangerous, especially for people over 60.
Why?
Because they contain herbs like senna, which is a powerful laxative, and dandelion, which is a strong diuretic.
So you're losing water and electrolytes very quickly.
And if you're already on a diuretic for your blood pressure or heart failure, you can become dangerously dehydrated.
What happens then?
Your blood pressure drops. Your heart rhythm becomes irregular. You can pass out.
I had a patient in Japan who drank detox tea every day for a month.
What happened?
She developed a heart arrhythmia, atrial fibrillation,
From the tea?
Yes. Her potassium levels were dangerously low,
That's terrifying.
and she thought she was doing something healthy.
So our advice? Stay away from detox teas. If you want to support your kidneys and liver, drink plain green tea and eat real food.
What about celery?
Celery is interesting. It has some diuretic properties, and it's very low in calories.
But it's also very low in potassium. A whole stalk has maybe 100 milligrams,
So you'd have to eat an enormous amount to get any real benefit.
and nobody's going to eat 10 stalks of celery a day.
Exactly. So celery is fine as a snack, but don't rely on it to reduce swelling.
You're better off with cucumbers, which have more potassium and more water.
Now, the big one. Drinking less water. We touched on this earlier, but it's so important.
People see swelling and think, I must be drinking too much water,
And they cut back to 4 or 5 glasses a day.
which makes everything worse.
Because your body goes into survival mode. It thinks you're dehydrated, so it holds on to every drop of fluid.
And your kidneys can't flush out sodium properly without enough water.
So you end up more swollen than before.
How much water should people drink?
At least 8 glasses a day. More if you're active or in a hot climate.
And if you're eating salty food, you need even more.
All right, now we need to talk about medications. Because this is where things can get dangerous.
Yes. If you're on certain medications, some of these foods can cause serious problems.
The biggest concern is potassium. Too much potassium can cause hyperkalemia, which is life-threatening.
What are the symptoms?
Muscle weakness, tingling, irregular heartbeat. In severe cases, cardiac arrest.
So who is at risk?
Anyone on ACE inhibitors, lisinopril, enalapril, ramipril. These medications cause your body to hold on to potassium.
And potassium-sparing diuretics, like spironolactone.
Right. If you're on those medications, you need to be very careful with high potassium foods.
Does that mean they can't eat bananas at all?
Not necessarily. It depends on their kidney function and their potassium levels. They need to work with their doctor.
And get regular blood tests.
Exactly. If your potassium is in the normal range, 3.5 to 5.0, you can probably have 1 banana a day. But check with your doctor first.
What about people with chronic kidney disease?
They need to be even more careful. Their kidneys can't filter potassium as well, so they're at higher risk for hyperkalemia.
Do they need to avoid all high potassium foods?
Not all, but they need to limit them. A renal dietitian can help figure out the right balance.
What about people on regular diuretics, like furosemide or hydrochlorothiazide?
Those actually deplete potassium. So people on those medications often need more potassium, not less.
So the 5 foods we talked about would be helpful for them.
Yes. In fact, many people on furosemide are also prescribed potassium supplements.
But wouldn't it be better to get potassium from food?
Absolutely. Food is safer and better absorbed, but you need to eat enough of it consistently.
So 1 banana isn't enough if you're on a diuretic.
No. You'd need at least 2 bananas, plus other potassium-rich foods like avocado, sweet potato, or spinach.
And your doctor should monitor your levels with regular blood tests.
Exactly. Don't just assume you're getting enough, or that you're getting too much. Check your levels.
What are the warning signs that someone should see a doctor immediately?
Sudden swelling that appears overnight. Swelling in just one leg, that could be a blood clot.
Shortness of breath.
Yes, that could be heart failure or a pulmonary embolism. Chest pain, dizziness, rapid weight gain, 2 pounds or more in a day.
Those are all emergencies.
Right. The foods we're talking about today are for mild, chronic swelling, not acute medical emergencies.
If you have heart failure, kidney disease, or liver disease, you need to work with your doctor on a comprehensive plan.
These foods can be part of that plan, but they're not a replacement for medical treatment. Now, we want to hear from you.
Which of these 5 foods are you going to try first? Drop a comment below and let us know.
And if this information helped you, please share it with someone over 50 who's dealing with swelling. Until next time, take care of yourselves.
And each other.